Following the local COVID-19 outbreak in March, there were reports of healthcare workers experiencing high levels of stigmatization and discrimination, as some Guyanese were of the mindset that medical professionals were possible carriers of the coronavirus due to their line of work and possible interaction with COVID-19 positive cases. Nurses and doctors were especially experiencing discrimination when they attempted to use private transportation or whilst moving around in other public spaces. However, according to information out of the Georgetown Public Hospital Corporation (GPHC), there has been a marked improvement in the treatment being meted out towards these critical frontline workers. This necessary change, according to the ward manager of the Accident and Emergency Unit of the Georgetown Public Hospital Corporation, Shanette Goodridge, is largely as a result of increased sensitization and awareness campaigns carried out by the hospital aimed at giving the public a better understanding of the indispensable role played by these healthcare workers during this global pandemic.
You don't necessarily have COVID-19, but we're hearing for your families or your friend or someone in your community that has COVID-19. The thing is, we as healthcare workers, we know all the techniques of washing your hands and so on, and we want to help everyone in the community, in our workplaces, and all our environments and the ministry to do the right thing. So as a group of body, we can help fight the COVID-19. I think with that message out, we have more persons who are coming on board to recognize, hey, the healthcare workers are actually risking their lives for us. So we need to show them some sort of kindness and appreciation.
Althea Bristol, ward manager attached to the Mill Medical Surgical 2 unit of the Georgetown Public Hospital Corporation, in also noting the vast difference in behavior by members of the public towards nurses, said that the numerous complaints previously received by her from her colleagues about being negatively branded have declined considerably.
But for the other nurses that would have complained, it is not that much now. I must say thank you to the public because they're coming on board, a whole lot of persons. There are still those who, we have those. But most persons are more respectful to the nurses, more accommodating.
Goodridge lauded the COVID-19 measures being implemented by the Georgetown Public Hospital Corporation to aid in the protection and well-being of its medical staff. These include free transportation for all medical staff as well as accommodation for those directly dealing with COVID-19 patients.
The Georgetown Public Hospital has been able to have accommodation for the frontline workers, especially those who are dealing specifically with the COVID positive patients. They've been able to have an accommodation where they can have rest when they're not on duty, have meals provided for them, and somewhere comfortable and safe, so that they don't necessarily have to go home to their families every day to put their families at risk. So Georgetown Hospital has been providing that.
For the HTP Nightly News, Amel Griffith.